Hey guys, this is Kirsten, and myself, Savannah, and Nidhi make up our group, and this is our accreditation presentation. The Public Health Department of Alaska, Department of Health and Social Services, is currently in the process of getting accredited by the Public Health Accreditation Board and aims at attaining the status by summer of 2022. This department is one of 5 state health departments in the U.S. which is not initially accredited. The Organizational Improvement Manager is the Public Health Accreditation Board Coordinator, along with 12 other team members who all have full-time job duties as well. So this is a secondary full-time job for them, essentially. But the Organizational Improvement Manager works on the majority of the workload related to the accreditation. For research purposes of this report, we focused on developing a plan for completing the CHA in alignment with the PHAB guidelines. This included collaboration with a local hospital and treatment wellness center and acquiring funding. The background, Alaska is one of the largest states geographically, and it covers 571,951 square miles. And as of 2019, the population was estimated around 731,545 people. A good amount of those, so 238,000, living in rural Alaska. The state's largest cities are Anchorage, Juneau, and Fairbanks. And according to the 2019 data from the U.S. Census Bureau, 65% of the state's population is white, almost 4% African American, 6% Asian, 15.6% are American Indian or Alaska Native, 1.4% is Native Hawaiian, 7.3% Hispanic or Latino origin. So the Alaska Department of Health and Social Services has devoted its Division of Behavioral Health on improving the quality of life of Alaskans through the right service to the right person at the right time. The central purpose of the division is to provide a continuum of statewide behavioral health services, ranging from prevention and screening to brief intervention and acute psychiatric care through that Department of Health. The mission, values, and the vision. So the mission of public health to protect and promote the health of Alaskans. The vision is for Alaskans to enjoy optimum health and safety through achieving greater public, community, and personal responsibility for healthy conditions and choices. And their values include accountability, respect, human potential, integrity, and scientific excellence. So for the accreditation profile, their current progress, we were able to reach out to Heidi Hedberg, who is the director for the state of Alaska for public health. She responded and gave us contact information for Melissa McGuire, who is the actual organizational improvement manager, and she's the one who's coordinating with those other 12 individuals in order to get the accreditation done. She does the main bulk of what needs to be done, but she does have those other individuals to help. So essentially, as I said earlier, she's working, 2 full-time jobs to get this done. The current projection, again, is summer 2022 for when they would finish getting that accreditation completed. The goals and measures. The goal of ADHSS is to align with the Substance Abuse and Mental Health Services Administration's objectives. We will also be covering the financial perspective of this initiative and what's needed from funding and how we look overall to our state and government. The measurement of these goals will relate to the rates of adolescent substance abuse before and after the program is implemented. And then those rates will be used to assess and change the project's goals and objectives to adhere to the needs of the Alaskan citizens. The first goal, to reduce substance misuse through prevention, will be measured through statewide implementation of education services in middle school and high schools. So we're going to use evidence-based materials found and they can be used to provide high quality education on substance abuse and information to deter the use of drugs and alcohol. There would also be training for educators. The second goal to expand prevention services and treatment involves services at the middle school and high school level. So this goal, although carried out at the state level, is measurable through local action taken to provide prevention services and subsequent substance abuse treatment for adolescents. Prevention services that adhere to a local population's substance abuse needs will be evaluated through recovery rates. So subsequent treatment rates for success rates for Alaskans will be measured through relapses and health complications of patients post-treatment. The third and final goal of expanding recovery support services and enhancing the quality of these services. This goal is going to be measured by routine state check-ins, training for recovery program employees, and retention rates from treatment programs to recovery support programs. So these guidelines will aid in the improvement of recovery-related services and help to ensure that the objectives are accomplishable. The area of focus is to reduce adolescent substance use and abuse. In 2018, 60% of drug overdose deaths in Alaska involved opioids, totaling 68 cases. And providers in Alaska wrote 44.9 opioid prescriptions for every 100 persons, which is a large amount. Residents of Alaska struggle with alcohol, heroin, methamphetamine, cocaine, prescription drugs, and marijuana, and Alaska, due to its location, is a really high transfer point for drug trafficking. 16% of all Alaska youths reported taking prescription drugs without a doctor's prescription. So that makes a goal is basically to reduce the percentage of adolescents who report binge drinking, and also to prevent substance abuse through programming and resource development. Much of the current substance use and abuse prevention work right now is done through the State of Alaska Division of Behavioral Health and various other community organizations. And this program is based on the premise that relationship skills are as important to learn in school as the other 3 R's, which is documented as reading, writing, and arithmetic. And if you think about it, it is so important. We teach reading, we teach writing, we teach math. However, we're not teaching youth how to engage socially, how to have relationships and make solid choices. All of those things need to be taught as well, so that when these issues come up with substance abuse, binge drinking, kids have the education and the know-how to make the best choices. The balanced scorecard, so it's basically utilized to measure numerous functions of a business or organization at one time. So these functions are both financial and operational in nature, and it was developed by Kaplan and Norton after they had done some studies that lasted about a year and included 12 businesses that were showing top performance. We created Balanced Scorecard to evaluate the accreditation process of the Health Bureau of the State of Alaska, and we included the following measures. The financial perspective, which is how we look to potential funders, including state and federal government. Diminished substance misuse and overdose, so what must we do better at in order to improve the population's health? Expanding prevention services and treatment, so how can we continue to improve public health in new and innovative ways? And the customer perspective, so how do Alaskan residents see us? Are we reliable to assist when issues arise? All of these are good to have, and we recommend that ADPH utilize this balanced scorecard to help achieve their accreditation goals and reevaluate as necessary when it's time, either to renew the accreditation and to go over these documents. This is a copy of our balanced scorecard. So it breaks it down into financial perspective, health determinants, resource, and community engagement. On the left, we have listed all of the goals that we have for each category. And then on the right, the measures that can be taken to get us to those goals. So recommendations. The Public Health Accreditation Board places a substantial focus on local health departments engaging with governing entities and policymakers. So the purpose of this measure is to assess the state health department's collaborative process for sharing and analyzing data and information concerning the health of their state, state health challenges, resources, and it helps to develop a community health assessment that accurately reflects the environment that they live in. The PABH requires local health departments to form collaborations with CHA and CHIP as per their standards and measures, which would require outside partners like hospitals and treatment and wellness centers to partner up and to have that relationship. ADHSS would benefit by such collaboration, and we recommend them to look outside their organization and join hands with Aquila Wellness Center, and they can help identify steps to align with the objectives of SAM-SHA. Requirements for hospitals. So hospital accreditation remains a cornerstone for ensuring at least a basic level of quality, and at least for things that the healthcare system assesses. So patients want to know that they are going to a hospital that is safe and has effective care. And if you have that accreditation, it really can be a powerful tool to offer assurance and confidence in what you're able to provide and the services that you give. Studies have shown that accreditation improves the overall quality of care in healthcare facilities. So it's really important that you have that and that you're able to showcase that. The interagency collaboration. So the purpose of this measure is to assess the health department's capacity to analyze and utilize data to identify trends over time, identify clusters, understand health problems, assess behavioral risk factors, detect environmental public health hazards, and recognize social and economic conditions that affect the public's health. So one major barrier in completing a joint CHNA and CHA is the fact that hospitals and health departments have different reporting requirement timelines. So it would be important to develop partnerships with key stakeholders, rural providers, federally qualified health centers, rural health clinics, and other health entities that serve rural populations, and to develop a joint implementation strategy to share scarce resources and reduce the burden of a single organization. So if one organization is handling everything, it really makes things harder. It's a bigger burden on that one organization. If you can spread that wealth out, you'll have more resources available, and it provides less of a burden to one area. The Division of Public Health at ADHSS is actively pursuing accreditation status with the National Public Health Accreditation Board. The process of obtaining initial accreditation status will give the Division of Public Health the opportunity to assess its performance against a set of nationally recognized standards and measures based on the 10 essential public health services. The assessment will encourage the division to build on its strengths and work to address the identified gaps to manage and maintain an effective state health department that works to protect and promote the health of Alaskans. The intervention strategy. Our goals basically would be to decrease substance misuse through the preventative and educational services, expand treatment services, and expand recovery services. And these goals will be carried out by substantial SAM-HSA involvement with ADHSS. This would be routine check-ins in cities and local communities where needs are present, training sessions for treatment and recovery services, education classes in middle schools and high schools. Once these assessments are conducted through ADHSS, a chip can be created. Once the chip is created, then the strategic plan can be developed through the proper accreditation channels. And at that point, a plan will come together and result in the PHAB accreditation. So it is this group's goal to be up and running by the end of 2022. And this is our presentation. Thanks for watching.